In this video, I'm going to show you how to do my favorite exercise for treating that stubborn mid-back pain. If I were stuck on a desert island, I would bring this one with me. Well, this one might not actually work on a desert island. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and in this video I'm going to show you how to do an exercise called Thoracic Extension in sitting. As I said in the introduction, this is my favorite exercise for treating mid-back pain because it's very effective, it helps me the most, and you can pretty much do it anywhere that there is a chair. So it might not work on a desert island, as I said in the video. As a little caveat, it's important to determine where your pain is coming from because that will let you know if this exercise is going to help you or not. So we're going to do a quick anatomy lesson, and to do that I'm going to use help from my model Chuck. He's going to help me out. Now, this exercise is to treat mid-back pain or thoracic pain. Here's our thoracic region right in here. If your pain is, say, right here, right at midline, then this exercise is likely going to help you. If your pain is kind of right here, running in between the shoulder blades horizontally, that's likely coming from your thoracic spine, and this exercise is likely going to help you. And pain at midline that starts at midline and kind of wraps around as if it's going around your ribs, that is also likely coming from your thoracic spine. Try this exercise out, as it is a thoracic exercise. If, on the other hand, your pain is not at midline, but it's off-center, maybe an inch, maybe a little more than that, kind of on the inside border of your shoulder blade, that pain is likely coming from your neck. This exercise probably won't hurt it, and it may help a little bit, but in order to get rid of this type of pain or to deal with this type of pain, you're going to want to do a neck exercise, and I've made videos for neck exercises. Most likely the one to help you is going to be cervical retraction and extension, which I've done in a previous video. Or if you have pain on both sides, but it's also not at midline, it's off an inch or so from midline, that is also likely coming from your neck. And I would also encourage you to do cervical retraction and extension, which I've done in previous videos, or one of my other neck exercises that I've shown in another video. All that being said, even if your pain is likely coming from your neck, this exercise may be of benefit to you because we're finding out more and more if you have neck pain or shoulder pain, oftentimes treating the thoracic spine, getting it moving better, does help both neck pain and shoulder pain. So either way, give this exercise a try. All right, so here's our chair. We take our butts, we scoot all the way back. And you notice where this chair is hitting me here, that's going to be kind of where the focal point of the force is. I take my hands, I clasp them, and I'm going to put them behind my neck. That's to support your neck, basically, and to help you get farther, because you're going to use overpressure to get back as far as you can. Clasp your hands behind your head, elbows in. Lean back as far as you can, elbows up to the ceiling, and back. Far as you can, elbows up to the ceiling, and back. Far as you can, elbows up to the ceiling, and back. And I bring my elbows up toward the ceiling, arch, 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 and then back. Up I go as far as I can, arch, 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 and then back. If you find that the chair, this one's kind of hard, if you find that it's uncomfortable because it's really poking into your back, just drape a towel over it or something like that. Here I go, arch, 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 and then back. Arch, 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 and then back. Holding for 1 to 2 seconds, doing a slow rhythmical movement repeatedly for 10 to 15 repetitions. Each time, try to go farther and farther into the range, and you might get a couple of pops and clicks as you go. As you do it, it should feel like you can move farther, your movement should feel more free, and when you get done, that pain should be diminished, and if it was painful to rotate or twist or bend, any of that should feel better. If when you're doing this exercise you find that you're getting excessive arching in the low back, maybe it hurts the low back, or you feel like it's actually targeting your low back more than your mid-back, this thoracic area, then what I would encourage you to do is take one of your feet and put it up on the chair. That's going to help prevent your low back from arching, and it will help focus the forces more in your mid-back. So bring this up here, if your knee allows. Clasp the hands behind your neck, same thing. Arch, arch, arch. And then back. Actually, I do feel that more in my mid-back thoracic region. It feels better for me. You don't have to do it this way. It's just a modification. Arch. Hold 1 to 2 seconds, and then back. Arch. Hold 1 to 2 seconds, and then back. Arch. Hold 1 to 2 seconds, and back. Thoracic extension in sitting. Great exercise for treating mid-back pain. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and I've just shown you how to do thoracic extension in sitting. The dosing for this exercise is 10 to 15 repetitions every 2 hours or is needed for pain. You could also say try to get in anywhere from 60 to 80 reps in a day. Stick to that dosing, and just within a matter of a few days, your pain's going to be diminished, maybe even all the way gone. As you feel your pain diminishing, you'll need to do the exercise fewer and fewer times throughout the day. And then it might get to the point where you just do it 1 or 2 times a day because it feels good, not because you feel like you need to do it. If you like what you've seen in this video, subscribe to our YouTube channel and click on the little bell. That way you're going to be notified each time we upload one of these new exercises, teaching you powerful exercises for treating your own pain. Like the video, share the video with your friends, and leave comments below. Let us know if you tried this exercise and if it worked for you and how it worked. And even let us know if it didn't work for you, because if it didn't work, then we can suggest modifications to this exercise which might make it more beneficial to you, or we can steer you toward another exercise that might be more appropriate for you.